There are over 20 million veterans in America. You may know some, and you may even be one. And chances are, if you're a provider, you may encounter veterans in your practice more often than you think. And you likely know that veterans are at increased risk for suicide. If you are a provider in the community working with veterans, we want to ensure that you never worry alone. I'm Bridget Matarazzo, and I'm a psychologist, and I work for the Department of Veterans Affairs, and I've been here for about 9 years.
And I'm Hal Wurtzel. I'm a psychiatrist with the VA, and I've been here for 12 years.
And we co-direct the VA's Suicide Risk Management Consultation Program.
Everybody's very concerned about veteran suicide, and risk management in that context can be very hard work and intimidating work. And there's no single solution for every case, so people really needed a resource to bounce ideas off of and to find best practices.
We started the program about 5 years ago in VA, and now we're really excited because we can offer the program to community providers working with veterans. To request a consult, it's free and it's easy. You just send an email to srmconsult@va.gov, and we can do the consult either over the phone or over email, whichever you prefer.
Hi Kaylee, this is Georgia from the consult program. How are you doing today?
Oh, very nice. Thanks so much for giving me a call.
So our servicemen and women have had some unique experiences by virtue of their military service. So things like combat PTSD or military sexual trauma may be real drivers for them. Being able to receive some coaching or some support from clinicians knowledgeable in those issues can be very helpful.
How many times has she attempted suicide?
So with suicide risk assessment, identifying drivers for suicide risk specific to the individual veteran is something that we can help with.
All overdose, right? But the most recent one, okay, so the most recent one, she tried to hang herself.
And then we can help brainstorm with you also about the best strategies to help reduce risk. So things like safety planning, lethal means safety counseling, and individual interventions to target the drivers of risk.
Think about, different interventions that can help either with, reducing maybe that chronic risk or that acute risk.
I think for the most part, keep doing what you're doing, particularly that idea of...
And a lot of times people are already doing that good work. We can help you make sure that your documentation reflects all the good work you're doing.
Well, I'm really sorry to hear about the death of the veteran that you've been working with. I'm sure this must be a really hard time.
We often also talk to providers about their experiences losing a veteran, which is known as post-vention.
Take some time away from work to take some time for self-care.
Our consultation team is made up of psychologists, psychiatrists, and social workers at the VA Rocky Mountain MIREC for suicide prevention. And each of us has specific training and experience working with veterans at risk for suicide. Many veterans in America don't get their health care at VA. This is why it's so important to support our providers in the community.
Doing this kind of work can generate an endless stream of what ifs, what could I do, what should I do. Those are hard questions to grapple with alone, and we don't want that to happen.
And that's why we say never worry alone.
To request a consult, you can email srmconsult@va.gov.